Well, thank you for joining us. I'm Dave Miner. I lead the research work for Indy Hunger Network, and yeah, a data geek, and excited to share a little bit of that with you today. I would be delighted for questions during the session, and so feel free to comment or question in chat or in the Q&A, and we'll try to address those as we go through. So today's talk is a little bit of how-to and a little bit of pep talk. We've had just some wonderful outcomes with Indy Hunger Network based on doing the research work, and so we want to encourage others to try it as well. Next slide. So just a little bit of orientation. Indy Hunger Network formed in 2010, so we've been going for 13, 14 years. And it's a collaboration of all the major food assistance providers in Indianapolis, our Feeding America Food Bank, a second food bank, and so on and so forth. A couple of corporate partners, a government partner, two government partners, and so forth. And the idea was to, by coming together, to try to ensure that anyone who's hungry can access the nutritious food they need. Common thing for hunger-free community groups to think about. Next slide. So what does Indy Hunger Network do? It does a variety of things: cooking education, innovations and information, marketing, policy advocacy, best practices. We convene, there are literally 200 food pantries in Indianapolis. We convene those pantries to improve operations, and we do research work. Next. Why do research? We have limited time and limited dollars, and so we want to invest those in the most effective ways. And I'll tell you a story in a minute about a major investment that we made, which wasn't necessarily the best because we were operating without the data we needed to truly understand the situation. If our goal is to end hunger, we need to understand how much is enough. We got started, as I mentioned, in 2010, and our initial sponsor was a corporate sponsor, Elanco, and they gave us a large grant. They gave us a loaned executive to help get going, and they really wanted to help. And they said, well, you know, if we're short of enough meals to feed everybody, how many meals are we short? And we looked around, and of course, nobody knew, and there wasn't a good way to find the information. So that is actually how we ended up doing our first survey, was to figure out exactly how many meals we were short. And without that data, we're just flying blind. We could spend a lot of time on stuff that was nice and good and helped some, but might not have shortened that meal gap that we were thinking about at the time. Also, research is super helpful for local data, for fundraising, to be able to talk to funders about the realities of the situation, and policy advocacy. When we got started, nobody really understood what the various hunger assistance, food assistance programs were contributing. And so it's hard to do good advocacy when you don't really understand the numbers. So we've been able to generate the numbers, and then to be able to take those and talk directly with our elected officials. Next up, quick bit of terminology. Food insecurity, of course, is what we all talk about, and that's a USDA metric with lots of validated methods for measuring it, different lengths of surveys. And it's important to know that's a number of people that are concerned about where their next meal is coming from. And that's helpful to know how many people hunger is impacting. But that's it's a people measure, really. What we were after was what we've called unmet need, meaning there was a need and not all of that need was met. So how many meals were missed by families who were in need of food assistance? And we specifically asked them for what happened in their family in the previous week, since we figured that was the amount that people could realistically remember. So if they needed a certain number of meals and they were able to get some of those with purchasing with their own money, some of those came from food assistance, which they did receive, then how much was left that was unmet need? So that was that, and that's the number of meals. Next. There are also a couple of other useful things. All of these are related but different. The Census Bureau measures food insufficiency, which is a number of households not having enough food. Again, there's a huge amount of power in the Census Bureau data, but it's a measure of households, again, not measuring how many meals you're short. Feeding America provides what they call meal gap, which is local food insecurity estimates, which are super useful. And then also what they think the weekly food budget shortfall is. And they're able to do this and provide this for communities all across the country. And that is accessible for all and then extremely helpful, but again, doesn't necessarily tell you where you are in terms of providing meals. Next. So really basic. I hope everybody's doing this, but if not, I would highly recommend it. Next slide. What's the supply of meals in your community? Next. So you can collect supply data. We collect it by contacting or getting access to listings from the state agencies in Indiana. And it's actually different parts of Indiana state government that run SNAP, school meals, and WIC. And so we can find out from FSSA, who operates SNAP, how many dollars they provided. And then the Department of Education can provide us with information about how many school meals, and that's measured in meals, of course. And then WIC also runs out of our health agency, and they also are providing numbers in dollars. Across this, we collect this data. We have a volunteer who serves as a data steward for us, and he collects this information for the whole state. And we have a number of Feeding America food banks across the state. We also have an independent Midwest food bank. These are providing numbers in pounds. And we have a standard conversion factor that we get from Feeding America to convert that into meals. And then we have other agencies as well, senior agencies, Meals on Wheels, and some other smaller ones, and also make a rough estimate of the food that's collected or purchased directly by food pantries. And this last ends up to be a pretty small number, but we want to make our best estimate at it. So the data in dollars and pounds is converted to a common unit of meals, and then we can say, to a reasonable degree, here's how much food is being provided in the way of assistance, and we can provide that by region, by food bank territory, by county, by congressional district. It's super useful. Next slide. So the first time we did this, we made a pie chart with the data that came out. And I think we were all hugely surprised, particularly our nonprofit partners, about the major contribution of SNAP. At that time, it was 74%. Since then, it's running about 46%. But the federal programs, if you add school meals and WIC and TFAP and more into that, 85% of our food comes from federal nutrition programs. And that's extremely helpful to know and to work on improving those and making sure they aren't cut by talking with elected officials. So meal supply is one important piece of research. Next. A second thing that you can do is surveys of individual programs. So what, how are different programs working? Next slide. So these are some example results for individual programs. We've done multiple times, we've looked at SNAP, and we've learned that SNAP users are able to eat more often able to eat balanced meals. Obviously, that's a good thing. And significantly fewer went hungry. And that's a really big difference versus people who are also of the same income bracket, but were not on SNAP. And again, this is local information, can be used locally. We found, we looked at Meals on Wheels, and we looked at our senior programs and found statistically significant improvement in realization of USDA guidelines for fruits and vegetables. So again, powerful data, and data indicating that families using WIC had fewer missed meals. So that's all looking at a specific program. Next slide. We've also done a series of community-wide surveys, and this is sort of looking across the whole landscape of programs and people, looking outside of just the information we might get by surveying some people who came to food pantries, for example. Originally, we were dependent on interviewing people who had gone to food pantries, and that's helpful. But in these surveys, when we could go out to the community as a whole, we learned that there's a lot of people with a food need who don't go to a food pantry. Well, we really need to be talking to those folks and hearing from those folks, why aren't they going to a food pantry, since that should be accessible to everybody. So going outside and looking community-wide can really be powerful. But how do you do that? Next slide. Well, the very first time we partnered with a couple of professors from our local university, IUPUI, who knew something about how these kinds of surveys are done. We engaged a survey center, a survey center which is at Rutgers University, to actually do the work. Also got some help from the Marion County Public Health Department. The initial surveys were telephone research, so random telephone survey. They'd dial and dial and dial until they got somebody, and then if they were willing, they would ask them all the survey questions. In the short period of time since that first survey in 2014, all of us, we don't answer our phones anymore if we don't recognize who's calling. And so random telephone survey is really not a very viable approach. So we have switched to using a commercial survey firm. The one we are working with is called Dynata. They do surveys for all kinds of different organizations all over the place, even internationally. And so they provide the people to be surveyed. We also get contacts through our public health department, and those two sets of groups of people then get funneled into an internet-based survey, which is helpful and particularly on the back end. It greatly facilitates data collection afterwards and assembly. So with those first telephone and now with internet-based survey, we've completed 5 major surveys. We have a 6th that was in the field earlier this year, in which we're in the process of analyzing and writing up. Sample sizes between 400 and 700 families. So that's enough to get a good glimpse on the majority populations, to get some decent statistical data on the results that you see. It's not enough to look at smaller population groups. We have a lot of Burmese immigrants, for example, in our community, there just aren't enough to be picked up in a sample size of 5 or 6 or 700. So this is going to get them. For us. This gets Caucasians and African Americans, Black families. This doesn't get the smaller ethnic groups. We have used this to directly measure actual missed meals in the prior week. So we ask the people, how many meals did you miss last week? How many partial meals did you miss last week? And we set it up with some things to try to hopefully get an accurate response from them. But then while we've got them, we also find out what food assistance services they use. We get demographics. We ask them during the pandemic. We asked pandemic-related questions. So while we've got them, we get a variety of information. Next. So what does it take to do research studies? Well, funding is critical. We've been fortunate that our first survey was sponsored by our lead sponsor, our corporate sponsor, Elanco. We've had support from the city of Indianapolis. They actually have funded this year's survey completely. We've also had support from foundations. In some cases, some funders really want to support research specifically. And so if you can find people for whom that's the case, then you can maybe get the support that you need to do this work. When we were first starting out, some of our nonprofits were really concerned about this. Well, wait a minute, we're going to spend money on doing surveys instead of buying food with that. But we argued with a couple things. One, that we needed to be able to guide our work better. And number two, there are people that this is really what they want to fund. And if they want to fund it, great. Let's take that funding and do the surveys. And also, so I've said there that our experience has been our total costs. We get some things we have to pay for, and we get some volunteers as well. Has run between about $20,000 and $45,000. And then we've also found we need some money to make sure that our results get widely communicated. But the $25,000, $30,000, $40,000, this is a tiny fraction of even what our food bank spends. And if you look at the whole system with the federal nutrition programs and food bank and food rescue and everybody else, the amount of money being spent on food is on the order of $1 billion. That's a billion with a B. So spending $35,000, $40,000, $50,000 to figure out how this is actually working is a tiny investment in making the systems work better. You do need some people, though, to do this. University researchers. We've had significant help from epidemiologists at our public health department. And then we've been fortunate enough to have some people with professional skills in this area who were willing to help out. And so with those pieces together, we've been able to pull it off. And I might add, from the university standpoint, sometimes the university researchers are looking for dollars for their own research programs, and that's not going to be helpful. But hunger is a compelling issue, and hunger on college campuses now, food insecurity on college campuses runs twice the rate for the general community, and so we have found some real interest among the university communities in doing what they can do to help out with hunger. Next slide. So this is what sort of an overview of what we've been using for our surveys. So we start with some qualifying questions. Does the person know about what's happening with food in the house? Are they in the right geography? We only talk with adults. So some qualifying questions in that way, and then that's followed with a 2-question screener. This is to figure out if they are in need of food assistance or have been using food assistance. There's a broader community, of course, of people who don't need food assistance, and that's not who we're surveying. So the food shortfall screener helps us separate whether this is somebody who should go further or not. We then include the standard USDA module for food insecurity, which is 6 questions. That's useful for measuring food insecurity. It's also some of those questions some of those are really good questions in there about nutrition, for example. And then we go into a few about where is the household getting their food, both with federal programs and with private programs, so we know what they're using. We ask we have a module then about meals missed, and then go into meal quality and other parameters, things like if they are lower income and they aren't told us they weren't using SNAP, why not? If they didn't go to a food pantry, why not? As well as collecting demographic information. Next. So what do you get from all that? Well, I want to tell you, I want to share one story, and this story actually began before our first survey. So before we'd ever done a survey, we just were getting started, and we wanted to get busy and use this funding that we'd received and this loaned executive. And so we decided we would have a major focus on the summer food service program, the program that provides school meals to kids during the summer. We had been told that we knew from Indiana data that lined up with the national data that only about 1/6 as many meals were being provided through the summer food service program as was done nationally, or pardon me, as during the school year. So we thought, well, let's really go after this. So these are pictures of some of the things. We had billboards and yard signs for the locations that were offering the program, and press conference to get movers and shakers involved. Next slide. So we thought, okay, summer food service program is providing only 1/6 as many meals as school meals. That's a lot of kids going hungry. Let's see what we can do about that. So we really undertook a major campaign, spent a lot of time and quite a bit of money, actually. We did lots and lots of parent surveys. We worked with some of the school systems and got them to send home surveys when they were sending home materials anyways, and we had thousands and thousands of parent responses. We did branding. That sign on the previous slide, we thought that summer servings with a little spoon in there was kind of catchy and would help people recognize, because before that, people didn't know where these programs were. They didn't know that, if 2 places are offering it down the street from each other, is it the same thing? So we standardized the branding. We provided signage. Most of these summer food service program sites were mom and pop, so they didn't have much in the way of signs. So we provided signs. We did the billboards. We provided incentives for sites to operate and supported them. We did public events. We did one summer, we sent people out into neighborhoods and literally went door to door. So just a huge amount of effort. And we did see an increase in meals, but the meals increased only about 25%. We had been hoping that we'd be 100 or 200%, that we'd see 2/6 or 3/6 as many meals, but instead it was only up 25%. And this was surprising and disappointing. But when we got into doing the community-wide surveys, we figured out what was going on. Next slide. The short version was the seasonal differences in need. It was really the winter that was the problem in Indianapolis, not the summer. So next slide. This was a huge surprise. So in that very first survey we did, we included this question: when would you say your family did not have all the food you needed? Was it during the spring, summer, fall, or winter? And they could check 1, 2, 3, or all 4. And you can see that summer at 35%, didn't look much different than spring or fall. And this was really surprising to all of us. And winter just stood out like a sore thumb there at 77%. So um, there wasn't a big difference in the summer when kids weren't in school versus spring and fall when they were. So we did organize some focus groups to understand about that, and we took what we learned from the focus groups and put that into our next big survey, which confirmed qualitatively that the difference was due to utility bills, high utility bills here in the wintertime, transportation problems for people, and seasonal employments. Good jobs in the summer that pay well, those jobs may not, like construction, may not be operating in the wintertime. And so for all of those reasons, summer really wasn't the big problem. And we would never have known why we were working so hard and not getting much for it if we hadn't done the community-wide survey. We have since, we're not investing in the same way anymore in the summer food service program. It's still a good thing, but we're focusing our work elsewhere. Next. So looking at that from a systems view, what else have we learned? So we've looked at lots and lots of different things. This was a look at the whether people had unmet need or not. We called households where they needed food assistance, but with the help of food assistance, they had all of their needs covered. We called them met need. So this slide, we compared met need with unmet need and by economic status. And you can see that there really isn't a huge difference between people in deep poverty, less than 50% of the federal poverty level, up to greater than 185% of the federal poverty level, not eligible for any programs, but still having people in need and a mix of met need and unmet need. So this was helpful to us to know that, basically we'd kind of expected we'd find the unmet need was sort of constrained to one part of the economic spectrum, and that just wasn't the case. We also found no major differences across ethnicity, geography. People thought, well, maybe it's one neighborhood. Nope. And it suggested to us that in general, the food assistance systems are working pretty well. Next. So this is a summary across those 5 surveys of meals missed on the top there, and then the meal supply. Next, there's a build slide. We should get another bar down there. Yeah, thanks. Great. When we looked at the meals missed as a percentage of supply, we found that only about 2 or 3% of the need is being missed. And so that's still a lot of people, a lot of meals, but it's also greatly encouraging. And it sort of suggests where our work maybe should go if you're meeting 97% of the need. And what it has suggested to us, 3 things, is it's an access problem. There's enough food out there, but people aren't able to get to it. And there's also, not seen in this data, but we've also seen that nutrition remains a huge problem. Next. So with all of this together, we've been able to assemble a picture of the hungry that, again, is really helpful to guide our work. While there's great diversity of ethnicity, incomes, and other factors, the combination of programs, public and private, are meeting most of the need most of the time. But life in the scramble for individual families means they're sometimes not able to access the food that's, in theory, available to them. And so in any given week, in those 5 studies, about a quarter of those needing food assistance would go hungry. In our latest survey, the data from which is just coming out now, it's actually very concerning. That 26% number has jumped above 40%. So about 42% of the people needing food assistance are going hungry in a given week. When we look at the number of meals that they've missed, it's very small. On average, when people miss meals, the number is small on the average of 3 per week. So we have only a tiny fraction of people who are missing large numbers of meals. But still, this is a significant issue. But this is the sort of the picture that we can get with the research efforts that really allows us to guide where we spend time. Next, so a better understanding of actual performance by individual programs and across the whole system, I think, is much needed. And my hope, my wish, my desire is that we would see multiple hunger-free community groups across the country doing this sort of work, because I think this could play a vital role in coordinating improvements to a vast system of food assistance. In fact, if I was the czar of all Russians at USDA, I would want to have 6 or 8 or 10 strong community organizations who are doing this kind of research, who could feed into us at the USDA to tell us what really was most needed. So that's it. I would welcome any comments or questions. Last slide. Thanks. Yeah. All of these studies can be found on the Indy Hunger Network website, which is there, and the specific link for the research reports. I would be happy to hear from anybody with questions or comments. We'd really like to support more people doing this kind of research. Somebody must have a question for me. Well, if not, we'll give you some extra time back, and thank you for being part of this. Thank you for being part of the Hunger Free Community Summit.
Thanks so much, Dave. And everyone, if questions come up, feel free to grab his email from this slide and send those on over.
Oh, I see one here from Amelia. Amelia, that's a really excellent question. I actually think that's been the hardest part. We have done press conferences. This doesn't necessarily get a lot of attention, but we've tried that. We've talked with our news media in general. We've done seminars inviting everybody that we know of, at least in the hunger community, to join in. Shared it with the food banks. So that's actually been the toughest part of this. Samantha, which stats were you interested in? Yeah, we can back up. Can we, Alabama, can we back up a little one? Let's see. Yeah, right there. Yeah, so that when we look at in the survey, we've asked people how many meals they missed, and by extrapolating, then we can find out that what percentage, how many meals were missed across the community as a whole. And then when we take that as a percentage of the meals that are provided, that's when we find out that we're meeting about 97. By the way, that in this year's survey, it looks like that has dropped significantly. I don't have final numbers yet, but I believe it might be a 90%, but still most of the need being met. And again, that's asking the survey respondents how many meals they missed, extrapolating that to the population as a whole, and then comparing that to all the meals supplied, that first piece that I talked about. And then in the survey, of course, some of the people said that all their needs were met, and so that's where the percentage of people who went hungry in a given week came out. So that's where that came from, and that was a very steady high 20s, 26% on average for the first 5 surveys. And as I mentioned, in this year's survey, it looks like that's coming in about 42%. So it looks like things are much worse this year than they've been even during the pandemic. Esther. Yes, also an excellent question. We stole questions from a variety of directions that people had experience with, because if you don't ask a question well, you may not get good data. We have always tested what we planned to do with our partners. So here's the list of things that we're planning to do. Actually, before that even, we've asked what is it that they want to know. And then as much as we can, we incorporate that in and test with them. Here's what we're planning to cover. And so they are built into the list of questions. So thanks for the questions.
Looks like there's a couple more in the Q&A tab, Dave.
Okay. Carly asked, did we face pushback from community partners when we changed direction away from summer food programs? Yes, we did face pushback. I'll tell you who we faced the most pushback from. We faced the most pushback from the state agency that oversees SFSP, because we had been helping drive their numbers, and then things didn't look quite as good when they had to report to USDA. And there was some angst at the community level as well. But we had to go with what the numbers said. So yes, we did have some. It wasn't major, but we did have some pushback. I think that's it.
Thanks so much, Dave. I just wanted to make a few announcements before we end here today. Up next is going to be a main stage session titled Using Research to Create Hunger-Free Communities. Right around 11:45 Pacific, a window will pop up and prompt you to join the next session. So go ahead and click that join button to enter. This will conclude our time together, and we hope you have a great rest of your day.